We made this decision largely for the reasons that Ronnie and Elias have said, but we were much earlier in this in that it wasn't some sort of a triggered decision for us. There was real frustration on the background years ahead of time. And our IT team actually really wanted to explore the space. And so what we needed to do was make sure that our radiologists were on board with something that our IT team really wanted to look at early. And so this meant years of us going to RSNA, looking at who was in the market, talking with vendors like RadAI and a couple of others out there. To be honest, when we were looking, there wasn't a robust market for new dictation software like there is today. And so I'm really happy to see that. But ultimately, we needed to make sure that our chair was on board because he is the system radiology director across all of these groups. We had to make sure that each group president was on board. We had to make sure that our executive director of radiology across the system was on board, who is an administrator. And then we also had to make sure our finance team was ready for this because this is a huge change and there are always dollars behind any sort of healthcare decision. So once we had those things lined up, we were able to really solidify what that looked like going forward. But it was a multi-stakeholder effort.